We've been talking about sleep. This is Jerry Block, a medical doctor practicing for 50 years. And probably, like most of you, have had very good night's sleep and sometimes very poor night's sleep. As a youngster, I had a difficult time sleeping. I had a hard time turning my brain off. In fact, even now, occasionally, my mind goes 24/7. And if one can't turn off their brain, it's very difficult to sleep. So way back, I looked into the literature. This is well before college. When I was 19 years old, I found Emil Coué. And with his relaxing techniques, at age 20, I found the first time that I could remember then how to get a good night's sleep, how to count backwards from 20 to 1 by taking a deep breath. And with each number, I got progressively more relaxed until I got to 1. I took one final deep breath, closed my eyes, turned it all off, and within a matter of moments, I was fast asleep. Well, this had been my technique. Today, I have several more, and in the future, we'll talk about it. So I'm here with Dr. David, and he wanted to prompt me about several things that I should cover during these sessions. Dr. David, what would you like me to talk about?
Absolutely. Thank you, Doc. First of all, why is sleep so important to human health?
It is sleep where our body regroups, recoups, regenerates. Our immune system really goes to work. White cells, which have been sort of resting, go to work. They travel throughout our body. The natural killer cells look for things that shouldn't be there. Our immune system builds up with the globulins, the antibodies. They're increased during the night, and they're getting ready to get rid of unwanted invaders. More than that, there's repair to our body. Our bones, our joints, our muscles repair. And without this needed repair, they continue to work and break down a lot faster. Our brain needs to repair, and we can spend a long time talking about REM, rapid eye movement sleep. If we don't have at least 4 dreams a night, our brain won't work as well the next day. In fact, they've done studies where they inhibited REM sleep. We can determine if somebody's REM sleeping because the eyes move, and one can put a little device on there and determine if the person is dreaming or not. Well, in this particular study, they woke the individual up, would not let him dream. After 7 days of not able to dream, the individual started hallucinating, almost went psychotic because they started dreaming during the day. They couldn't keep their thoughts straight. The day and night thoughts were intruding with each other. So REM is very, very important. We need to dream. Now, Freud thought we needed to dream to get rid of our frustrations, but now neuroscientists know that we need to dream because if not, our mind doesn't regroup. So this is just part of the reason that we need sleep. David?
Thank you, Dr. Block. The other question, obviously, okay, so primarily sleep is for us to help repair, for our bodies to repair. Now, we know about melatonin, and I'd like to mention that. That is a key factor in sleep. And so what turns it on? What turns it off? Are there sleep habits that turn off the production of melatonin and keep us from enjoying a good night's sleep?
Melatonin. We all naturally have melatonin. The pineal body, the remnant of our third eye, since before evolution, or maybe even the Garden of Eden, was in existence. It was able to tell day from night and the change of the seasons. Animals would learn how to breed or naturally get their key to breed with the day getting shorter or the day getting longer. Also, one needs, in addition to that, a circadian, a daily rhythm. And melatonin is produced in response to darkness. Normally, after one goes to sleep, about 2 hours later, there's an output of melatonin, which ensures us to have a good night's sleep. Melatonin is produced naturally, and the more melatonin, the better night's sleep we have. But more than that, melatonin itself is an antioxidant. It stops the pro-oxidation that has occurred during the day. So not only does this ensure us a good night's sleep, but it's also rejuvenating. And as you can imagine, the individual that has the most melatonin is a baby. And as we get older, we get less and less melatonin. And as we get to be old age, in general, we have far less melatonin than when we're in our teens, 20s, and 30s.
Interesting. So there are obviously some occupations and habits that keep us from producing enough melatonin.
Yes, one that occurs, unfortunately, in modern civilization is shift working. People that have the so-called graveyard shift. And one of these days we'll talk about why it's called a graveyard, other than it will put you in the grave earlier than otherwise.
Okay, great. Well, we're going to move on to the next series of talks on sleep, but for now we'll shut it off for now and then move on to the next one. Thank you again, Dr. Block.
My pleasure.